All right, good evening. We made a counteroffer to the governor. I think he's going to say that it wasn't enough, it wasn't right. He's wondering why we don't want to agree to the 2% provider tax or sick tax or any of the transportation money. He's going to say that he wants that on the table. It's never been on the table for us. We don't want to put it on the table. And one of the things I want to talk about is right here we have $491 million that automatically moved to the budget reserve in the November forecast. And so that's something that we presented this time around, that we want to consider using that. And so we made an offer to cover the deputy registers in there. That was $13 million. And then broadband, which is $30 million. We said, let's cover it out of our reserves because we put a large number in the reserves, and we have the largest budget reserves that we've ever had. And so we feel like we can use some of that because of the fact that the omnibus bill last year didn't get done, and there was a lot of unfinished business from last year that we feel like should be covered in there. And so that was our counteroffer today, or I should say just now. But the other thing we said to the governor is we made an offer of $100 million in the general fund, increasing two things. E12, we increased $75 million, and public safety and judiciary, we increased $25 million. There was no counteroffer back on those general fund budgets. Those are the 10 budgets that we have to get done, and that's where we're asking for some movement. So that's where we're at right now. It doesn't feel like we're in a good spot, but we're going to keep pushing through.
Are you going back to dinner, sir?
I believe so. We're going to have dinner. They're going to talk with their group about whether they want to. We're suggesting that we do. There's a lot of hard work that has yet to be done.
Senator, you dip into this reserve, these reserve accounts. Why don't you make it worth your while and get more than $43 million?
We're simply showing that this is an area that we should consider. There's a number of things that we would consider there, but because they didn't make a significant counteroffer back to us in the general fund, we just left the door open that that's an area we should consider.
Senator, there is such a wide disparity in your proposals. A lot of these offers seem like they're just nibbling around the edges, and the big elephant in the room is the gas tax and the healthcare provider tax. When is there going to be major movement there?
Well, that's our point, is we already have large resources that we can use. We have $1 billion of surplus. The latest numbers in April came out, $489 million new money that we're not even counting. We're above forecast a total of $473 million, and we have $2.5 billion in the reserves, of which 491 came in November because of the bills that were vetoed by the governor, at least as part of it. So we're simply saying we have resources. In addition to that, we had another $2.2 billion that our government grew, the forecast number. And so we're saying let's live within resources that we have. That's 5%, but we've already moved up from there. And so we're saying we don't need taxes to do it, and the governor is. And that's why it's such a difficult place that we're at. I'm suggesting that we all focus on the 10 budget spending targets. Let's see where those are, and let's see what a budget looks like so we know how to get to the finish line.
Mr. Leader, can you see the budget surplus, or not the budget surplus, the reserve rather, being substantially reduced to take care of this problem? Would your caucus advocate doing a substantial reduction of that in order to maybe to try to get close to the government?
I would say we're open to some budget reserves, and that's why I point to the fact that $491 million went in November. So that's kind of why I say that. Plus, in addition, if this number continues to grow, come next November, there's another grab that goes into the reserves. And so that's why we're saying we're at a place that some of that reserve shouldn't have been in there if we'd passed that omnibus bill last year. Broadband was in there, safe schools, a number of other things, and we're saying we should be open to that.
Senator Gazelka, your language on the gas tax has been slightly different than your language on that 2% medical provider tax. You've been saying no line in the sand when it comes to the gas tax. Where are you on the 2% medical provider tax? You said that you were going to talk to people and clinics in your area and your district. Where are you on that?
Yeah, so we're listening to all people. We want to get the 10 budgets put together so we know exactly where we're at. We don't know where the governor and House will agree to with us for spending targets in each of the 10 areas. That will give us a clear picture of what the overall budget looks like. Right now we're worlds apart, but we have to work together to get to a place in the middle.
A week later, you all had a self-imposed deadline on these targets, and now here we are in front of a billboard with emojis on it. What's this like for you?
So what I would say is, I don't know how many times in a row now that we haven't reached targets till Friday, Saturday, Monday of the end of session. We're all aiming for tomorrow night or Wednesday morning. That allows us to get done in time. And so I'm not giving up on that. That's, I think the governor and the speaker also want to do that. It'd be nice if we actually finished on time. That should be our goal. We have to have the spending targets first, and then we see how everything fits together. All right, thank you.